Hello, everyone, and thank you for joining us. It's now 7 p.m., so we'll get started. If there's any questions today, please submit those into the Q&A pod that's located in the black toolbar. If you experience technical issues today, please use the chat where you said hello and letting us know where you're joining from. So with that being said, I'm going to hand things over to Suzanne Triplett to get us started.
Thank you, Cameron. Welcome, everyone, to the Pennsylvania Multi-Site Health Study Information Session. My name is Suzanne Triplett. I work at RTI International. I'm one of the study directors for the Pennsylvania Multi-Site Health Study. Next slide. So we wanted to, of course, welcome the entire community to this December meeting. We have several presentations that we'll be reviewing tonight. Next slide. This slide gives a brief outline of what we'll be covering as part of this meeting today. We will be starting the presentation with a session from Dr. Risa M. Jones from Temple University, is one of our co-investigators on the Pennsylvania Multi-Site Health Study. She'll be covering PFAS exposure and potential links with cancer. Following Dr. Jones's presentation, our lead principal investigator, Dr. Linda Morris Brown from RTI International, will be giving the community updates on eligibility criteria. Following Linda's presentation will be an update from Ms. Susan Wood from the Pennsylvania Department of Health on our community advisory panel, work that's been done to date and what's to come. And we'll be closing out the community meeting this evening with a video message from a local family that was personally impacted by the exposure. And that section will be hosted by Ms. Hope Gross and Ms. Joanne Stanton of Bucksmont Coalition for Safer Water. Next slide. So asking questions, I know Cameron briefly went over this. We'll be hosting a Q&A session at the end of each session this evening, a little different. So you can raise your hand at the end of each session and be given microphone rights to ask questions directly of presenters. If you'd like to remain a little more anonymous, please feel free to submit your questions at any time through Zoom's Q&A feature. And just a friendly reminder to leave the chat feature for more technical problem questions, if possible. So thanks so much. And next slide, I will be turning this over now to Dr. Jones from Temple University.
Thank you, Suzanne. Go ahead and next slide, please. It's great to see so many people here participating tonight, and I looked at the participant list and I'm seeing quite a few recognizable names, so thank you for joining us. As Suzanne mentioned, we are recording. Some of the slides that I'm presenting have more information maybe than what I'll cover, and so feel free to go back to the presentation at your leisure and look at things afterward, and feel free to email me if you have questions that come to mind after tonight's session. I'm going to be presenting on two different cancer-related projects. The first one is actually something that's already been funded. I have some preliminary data from qualitative research we've done. And then the second item is some planned analyses that we have in conjunction with the multi-site health study. Next slide, please. So this first project is actually being done in partnership with Bucksmont Coalition for Safer Water. Joanne Stanton and I had connected over 2 years ago now and talked about how it would be so helpful to have more information and understand the community's perspective about PFAS, and then also provide educational or outreach opportunities. So as part of this, the research side of things, we plan to do 6 focus groups and key informant or stakeholder interviews. So with the focus groups, those were with adults, people 25 to 80 years of age living in Bucks or Montgomery counties. We planned 6 2-hour meetings, and people needed to live in Bucks or Montgomery, but we included people who had both municipal or private wells, and people received a $50 thank you incentive. For that aspect, we identified or aimed to identify perceived health and psychosocial issues, as well as financial impacts of PFAS as perceived by community residents. For the in-depth interviews, we contacted 8 different key community stakeholders and worked with them to understand what they saw as community level issues and areas of need. We are in the middle of the focus groups. I just want to say that what I'm going to be presenting tonight are from 3 focus groups, and then the 8 community stakeholder interviews. Because of COVID, we needed to stop focus groups back in the spring, but we are seeking approval to be doing some Zoom virtual meetings. So be on the lookout for 2021, early in the year, hopefully doing some Zoom meetings, and anybody who's 25 to 80 living in Bucks or Montgomery counties would be eligible for that. Next slide, please. So when we explored the 3 main topics for perceived health impacts, psychosocial issues, and then financial impacts, really the majority of people mentioned negative health outcomes, and particularly cancer. And in fact, almost every single person talked about cancer as the most important concern. And I've got some quotes here. We have hundreds of pages of quotes, and I just selected a few. The first quote: "The biggest concerns about PFAS in general is the health effects. Undoubtedly, it's the health effects. It's the unknown health effects, something to do with this cancer or that cancer health problem that somebody in the town is suffering from." Next slide, please. And with regard to the types of themes that emerged when we talked with people about their concerns about cancer, they were fear and worry, uncertainty, and wanting answers. As I mentioned, there were hundreds of pages of comments, and I'm just sharing 5 here. For worry and fear, these quotes highlight fear every time they go to the doctor, that they will find out that they have cancer, also being concerned about adults' health as well as children's health who have been exposed since they were young, and then worry about the cause and effect of PFAS in firefighting foam, as an example. And the last quote here really highlights the uncertainty and wanting answers. It's the lack of information for people. They just don't know. And I think it's because the health studies has not been able to be done. So therefore, anyone in, whatever 25-mile radius in either of these bases wonders, is my cancer due to this? So next slide, please. Thinking about these concerns, and also just working with our partners at Bucksmont Coalition for Safer Water, it became clear that the community really wants answers about cancer. And cancer is a very complex disease, or a set of diseases, and has multiple risk factors that vary for people over time and across geographic location. And these are environmental factors like PFAS exposure, and also socioeconomic risks and all kinds of other factors in addition to these. But cancer takes decades to develop, most cancers. And we call that a lag time. And that refers to the time between a possible exposure and diagnosis. So a lot of times doing cancer research is difficult because you might be exposed to something and it would take years or decades for you to possibly develop cancer. So making that link is a difficult thing with cancer-related research. But to date, there is evidence that PFAS exposure is associated with several cancers, namely kidney, thyroid, testicular, ovarian, and non-Hodgkin's lymphomas. Next slide, please. So in these previous epidemiologic studies, they're looking at populations. And of course, animal or rat studies have been done, but what we're concerned about or thinking about here are the studies at the population level with people. And they have various limitations. They have had a failure to model changes in exposure over time. Also, there have been limited inclusion of variables that would be needed to actually reduce bias in the analyses. And then also absence of spatial statistics or approaches that really would be able to more closely identify geographic location and risk. And these limitations include things like the zip code study that's been done in Pennsylvania. And we're building on that research. We're able to take a deeper dive now to assess the relationship between PFAS exposure and cancer. And we're able to do that because spatial analyses using advanced statistical approaches really is a quite highly informative strategy that allows us to look at potential health effects of PFAS exposure that has varied over time and over space or across geographic location. Next slide, please. So the purpose of our planned research, and now this is planned as part of the multi-site study, but it's a supplement. So it is not part of the core protocol that you'll be hearing about later, but this is an investigator-initiated study that we're doing that's being led at Temple. And we're going to hopefully conduct enhanced PFAS spatial analysis to assess the association between PFAS contaminated water exposure, incorporate residential history, and then select cancers using population-based incidence cases and cancer-free controls. And we're hypothesizing that cases are more likely to be exposed to PFAS contaminated drinking water than controls. And then there's a dose-response relationship between level and duration of exposure to PFAS contaminated drinking water and cancer. Next slide, please. So this is a map. This graphic shows the study area for this planned spatial study. And you'll see in red the original townships that are proposed or were proposed for the multi-site study. And then you'll also see that in addition to the original townships for the multi-site, it includes all of Bucks and Montgomery counties, as well as 11 additional counties that are surrounding or near Bucks and Montgomery counties. And this is important because it gives us an advantage because we're able to model or look at a range of PFAS level exposures across these different geographic areas. And that is partially how we are able to overcome some of the limitations of past research. And it's also part of the priority issue for funders like CDC and ATSDR, who have talked about and have now published priority for answering questions regarding cancer and shedding more light on cancer research. Next slide, please. So information that is critical to this work is really getting access to previously collected data at the individual level for cancers that have been diagnosed in those 13 counties in the study area. And this would come from the Cancer Registry of Pennsylvania. We would get cancer cases in the 13 counties. Anyone living in the 13 counties and diagnosed between 1990 and 2018 would be included in this study. The Cancer Registry is something that mandated that hospitals and labs and healthcare facilities need to report cancer cases to the Cancer Registry. The Cancer Registry in Pennsylvania has really good ascertainment, and they have been collecting data on all invasive cancers diagnosed since 1985. For the primary cancer sites, we have selected some of the cancers that there is the strongest evidence for a possible association to explore that more. And so the primary sites that we've selected are kidney, thyroid, testes, prostate, ovarian, bladder, colorectal, and non-Hodgkin's lymphoma. And during the study period, just in those 13 counties, there are over 865,000 invasive cases in adults in those areas. And so all of those people would be included in these analyses. We would also get residential address at time of diagnosis. So we would know geographically where people are and possibly then be able to model their PFAS exposure, as well as other variables, including date and stage of diagnosis and demographics. Next slide, please. So that's the cases, and we would compare them to cancer-free controls. And so we would actually purchase lists from multi-sourced sites like telephone directories, birth records, voter registrations, etc. And we would then compare and contrast and select cancer-free controls that are living in the 13 county study area. And those controls would be based on matches to geographic location and gender and age of cases. Next slide, please. We would also work to then create a residential history for each case. So every diagnosed case from 1980 to 2018, or excuse me, 1990 to 2018 in those 13 counties, and then the selected controls. Having the residential history would allow us to create a variable for the historical PFAS exposure over time and across geographic location. Next slide, please. And then importantly, we need the PFAS water exposure data. So for PFAS water testing from Bucks and Montgomery counties, we would have that data. We also already have data from ATSDR from testing in the Bucks and Montgomery County areas. We also would be able to take advantage of historical reconstruction data from the multi-site study, which you'll be hearing about more in a few minutes. Also, the Pennsylvania Department of Environmental Protections is slated to conduct more water sampling to test for PFAS throughout Pennsylvania. So we would hopefully be working with them to get more information from Bucks and Montgomery, as well as the other 11 counties that have been selected. And then because we might need additional water related data to more fully flesh out really assess the water contamination like we might like, we would be supplementing and planning some additional testing using selected water sources of municipal and private wells in the targeted areas, that 13 county study area. So we could look again at PFAS contaminated drinking water exposure and be able to model that over time for all controls and all cases. And with that, I'd like to open it up for questions. Next slide, please.
Right. Thank you, Risa. We've had several that have come through the Q&A feature. Risa, would you like me to read those out loud and you can answer, or pivot to? Yeah,
because I'm not sure where I should look to find them.
That's fine. I'm happy to do that. First question is more a comment from a community member that would love to be included in the next opportunity to join a panel. I was diagnosed with cancer a few months after finding out that my well water was contaminated. I also have too many neighbors in a similar situation.
Sure. So we can definitely, Joanne and Hope from Bucksmont Coalition for Safer Water, they've been fantastic about helping us get the word out about those focus groups. So that will be something that once we learn when we can start doing the Zoom virtual meetings, they would be able to promote that and provide information. And then we follow up with people who call us to volunteer.
Great. Thank you, Risa. And the next question is, can you include pancreatic and bladder cancer in the study? Both are significantly elevated in the exposure area.
Sure, thanks for the question. Actually, we can, in theory, we can do that, and we can definitely expand. Right now, what we have targeted and what we have the resources, financial resources for, are those cancers that I mentioned. However, if we end up saving our pennies and being very frugal, we might be able to explore other cancers at this time. And if not, definitely our idea is not to just do this one study and end. You know, we are building a relationship with Bucksmont Coalition for Safer Water. My colleague Robin Taylor Wilson, who's also at the meeting tonight, she and I at Temple really are committed to community engaged research. So thanks for that question. We'll definitely think about and probably get more feedback from the community about next steps.
Right. Thank you, Risa. And if next question is, if we participate in the multi-site study, how long will it take to get our blood test results? This is more of a core protocol question.
Yeah, I think this would be something that I would ask Linda to address. And I don't know if Linda, if you want to address that now, or if you want to save that and address it when you're speaking next.
Yeah, I don't think we actually have all that information yet so ATSDR is going to be, CDC ATSDR is going to be doing the testing of the blood, and we haven't gotten the protocols yet from them and the timing from them yet. So hopefully they will be able to give us some more information for probably our next meeting, hopefully.
Thank you, Linda. Next question, Rita, have you found any correlation to breast cancer?
So with breast cancer, actually, there have been mixed findings. Some actually have found an inverse association where PFAS levels, higher PFAS levels actually are protective against breast cancer. Others have found that relative risk of breast cancer is about twofold for people that have very high serum PFAS in their blood. And so, these studies are limited. They're very small sample sizes. And so with the studies that have been done to date that are better design and more rigorous, there's mixed evidence. So nothing yet.
Thank you. Next question, Risa. To date, the only two cancers that the independent CA science panel is linked to PFAS exposure are kidney cancer and testicular cancer. Is this study trying to link the other cancers that you had mentioned, like non-Hodgkin's lymphoma?
Yeah, thank you for that question. Yes, the reason that we're looking at other cancers is because while the C8 science, while that panel did not find that PFAS exposure for all kinds of cancers were related and just reported on kidney and testicular as being significant, we are including others that have had other evidence in the past. And then for each of the cancers I mentioned, we will be looking at each of those cancers separately. So we won't be looking at all cancers together, but we'll be looking at testicular and the risk with PFAS exposure, and ovarian and the risk, and non-Hodgkin's lymphoma and the risk.
Thank you. And how will you know the cancer is related to PFAS and not another factor or exposure? Many things cause cancer. How can you determine it was from water versus other exposures as PFAS is in household products?
Sure, and that's one of the limitations that others have had when they haven't been able to adjust for other items that might be confounding or biasing the results. I think for us, we will be using as much information as we can about, I didn't get into this just because it adds another layer of complexity, but we would also be adjusting for socioeconomic status and access and other issues. But certainly for a study like this, where we are relying on secondary data analysis, it is limited. But at the same time, this kind of case control study for incidence cancer cases and really looking at every single case of these selected cancers in those 13 counties, we also will be able to adjust for all kinds of information that are actually available from the cancer registry, such as smoking status and access. So it's not perfect, but it is an improvement over the limitations that have plagued other studies to date.
Thank you, Lisa. Will the results of the interviews and studies be made public? What's the estimated timeline?
Sure. So for the qualitative work that we've done, I just showed some preliminary analyses because we haven't finished the focus groups. Our aim is to have something ready for publication before June. June is when we will need to be reporting to the funder and giving them information about what we found. So yes, definitely that will be not only published in the scientific literature, but I'll be working with Hope and Joanne and Bucksmont Coalition for Safer Water to just disseminate it more locally to the public and the residents so the community can find out what we found out.
And given the number of cancers you are surveying, how much of an increase in cancer would be needed to rise to the level of statistical significance? A relative risk of 2, 3, 4?
So when we're going to have really 1.7 million people in the study, when you have such a huge sample size, it increases your precision, and it increases the likelihood and the power that you'll be able to detect a statistically significant difference. So with something like that, it would be fractions of an increase. It would not be twofold, threefold, fourfold. We would be able to, we'd have the power to detect slight differences. I'd have to look back at the power analyses to say exactly what it is, but with such high power, we'll be able to detect more of a minimal difference.
Okay. No, thanks, Risa. I'm actually going through the Q&A comments. I'm going to direct just the cancer questions to Risa now. I see some of the questions coming through really tie to Linda's presentation later, so I just wanted to mention that to the team as I move through these questions. Let's see, the next question for you, Risa. I'd love to be included in the next opportunity to join a panel. I was diagnosed with cancer. Okay, that one we had already covered. That's a Linda question. And private wells, that's our next session coming up. What is the time frame for completion of these studies? I think you've
so for the qualitative
briefly,
work, we'd hope to have that finished by June. And for the other work, this is getting data like this from the cancer registry. We're dependent on how long it takes them to pull data. And so it can be months before we even get the data. And this would be several years of work. A lot of it is waiting for the data and then modeling this. It's quite complicated because we need to geocode and assign everybody to an address, and then get the residential histories and create variables that allow the exposure to vary and do some truth testing with that and validation. So it would be several years before we'd probably be able to publish something on a couple years before we could publish something on the spatial analyses.
All right, next question that's cancer related that I see, Risa, is this is a great study methods question. How will supplemental plan testing relate to the cancer-free set among the 13 counties? Would we be able to figure out something like the historical PFAS exposure for a resident of a place like Berks County?
Yeah, so what we're intending to do is sample strategically in a geographic way to supplement what's already being collected, so that across the geographic space, we have decent data to model possible exposure. So we would be selecting those based on after we geocode or map where both the cases and controls live, and then also using publicly available data on water table, geographic information. We would use that and then specifically sample certain places.
And how will the DEP select water to test in the 13 counties, and can homes be tested for tap versus reverse osmosis systems to see what is effective if PFAS is present?
So the Department of Environmental Protections has already put together a plan. It was published and it's available. We can provide the link to this. Maybe Joanne or Hope, if you could get the link and put that in the chat, I think that would be great. And then we'll make sure that it's also in the comments for the presentation. But there are already selected sites and locations that were published back in April of 2019. So that work has already been mapped out, and I'm not sure where they are in the process of that, but that's the data that we'd be using.
And we have another question for you, Risa. Sorry, I came in late to the meeting. What cancers are you studying, and how are you picking participants for the study?
I'm sorry, can you Can you say that again?
Sorry,
Suzanne?
Risa. What cancers are you studying and how are you picking participants for the study?
Okay, just briefly, the cancers that we're focusing on for the spatial piece are kidney, thyroid, testes, prostate, ovarian, bladder, colorectal, and non-Hodgkin's lymphoma. And this is a case control study where the cases, people who have had cancer diagnosed, will come from 13 selected counties, including Bucks and Montgomery, and then other surrounding Pennsylvania counties. And so anybody living in those counties and diagnosed with those select cancers, adults between 1990 and 2018 would be included as the cases. And then we would work to get publicly available lists to then select cancer-free controls to compare and be able to assess the relationship between PFAS exposure and those select cancers and incidence cancers only.
Okay. I'm going to allow a couple more questions and then we'll move on to the next segment, but we can come back to this at the end as well. So I don't want people to feel like we're dismissing, not responding. Let's see, will all NHLs be studied in aggregate or will there be further breakdown of the different disease categories that fall under the broader heading of NHL?
Sure. Now, so if we can break things down, we will. Also, I mentioned that we'd be getting stage at diagnosis and things like that. And so we might be able to do other stratifications or subgroup analyses. It will just depend when we look at the data and think about really what would make sense from a statistical perspective, as well as a conceptual perspective, we'd make those decisions.
Do you know if you will have enough sample size for your study for individual cancer for your study?
I'm not sure exactly. I'm not sure if this is different than the other question. We definitely have more than enough sample size. For the kinds of analyses that we're doing, I don't want to get into the specifics, but it's Bayesian analyses looking at weighted quantile sums. And in general, there's a general rule of thumb that we would have sufficient power even if we had 500 people per group. And we're going to have over 865,000 in total. And for any given cancer, I think the lowest cancer incidence, oh, this is terrible, I should know this off the top of my head, but I think the lowest number of incidence cases for any one of these in total for the 13 counties was over 5,000 people. So even for each individual cancer, we will have 10,000 people that are included in the comparison. Because again, we'll be looking at this from 1990 all the way through 2018 and then adjusting.
A couple more questions, Risa, and then we'll move on to the next session. If we have time after that, we'll come back to these questions that some of them are more related to
Okay.
general study questions.
Okay.
Let's see. Some of these we could answer in Linda's section. I've been diagnosed with, and my thyroid has been removed for thyroid cancer in 2019. Will I be contacted to participate in the study?
So actually, no, you won't be contacted. Your data would be included. So with something like this, with publicly available data from the cancer registry, we're able to, for public health research, we're able to get waivers of consent so that we can get this information for health study purposes only. And so when this is all approved and we would get the data, we would have your data if you've been diagnosed with thyroid cancer in one of the counties, but you would not be contacted. We would use the data that are available from the cancer registry about stage at diagnosis, age at diagnosis, date of diagnosis, and metastases and that kind of thing. And let me just interject too, this sometimes can be something that's scary to people or they're worried about, there are all kinds of precautions and protections for people that are put in place. And we need to have only certain people having access to the data. We have to do data use agreements to really ensure that everybody's privacy is protected. And once we do the geocoding to be able to determine the exposure, then we delete all of the address information. We do not keep that longer than we need it to be able to geocode or place people in their geographic location. And I'd be happy to take comments offline or, emailing me if people have concerns or would like to discuss that more.
And how do you qualify for the testing group?
I don't think that's for me, Suzanne.
Okay.
I don't, because yeah, we're not doing, water testing or some other kind of testing. If it's testing for the multi-site, maybe. Sorry, I'm not looking at the. I don't see.
Yeah,
the,
no, that's all it says. That's all it says. We can come back to that.
Okay.
Maybe we'll answer that in the next session.
Okay.
And I think some of these we can answer in the next session as well. After Linda's, some of this will be answered. But I'll run through the ones that are still open after Linda's session. All right. Well, thank you, Reese. I think in the interest of moving along for the presentations and then allowing the Q&A at the end of Linda's session, we'll move on. Thank you so much.
Thank you.
Debbie, if you can go to the next section, I will turn this now over to Dr. Linda Brown from our TI. Linda?
All right. Hi, everybody. So I'm going to be discussing some of our eligibility updates. I think we started talking about this at our last meeting, and we have some more details for you. If I could have the next slide, please. So we've decided to do our sampling into two groups. The first group was we're calling our targeted participants. So these are going to be households with private wells that have PFAS values equal to or higher than 70 parts per trillion. We're going to be targeting participants who were in the previous PEAT study, which is biomonitoring study that was done by PADOH. And then we're also going to be, and we'll show you this on the map, what this area looks like. We're going to do something called address-based sampling. And those are going to be people that we think probably have the highest levels of PFAS exposure. And when you see the map, you'll see that these are clustered closest to the bases. And so they will be census blocks, and those encompass about 32,000 people and 12 households, or 12,000 households. And then our second group is volunteers. And so that means we'll be doing social media and that kind of thing. And we're going to open it up to the wider area. And the first area that we talked about, and which we described previously, and which we wrote about when we did our proposal, was really the townships of Horsham, Warminster, and Warrington. And that was an additional 49,000 people and 18,000 households. But we've, since that time, been looking to see what other kind of water data we would have available. And we think we can open it up to volunteers from other affected townships. And that would include an additional 181,000 people and 68,000 households. So we are hoping that we can expand this area quite broadly. And we're hoping that all of you are really interested in participating and that we can get our 1,000 adults and 300 children, which is our recruitment goal. And if, if we're lucky, we can get a little more, so we have a little padding. So, you might think, okay, you have 260,000 people, but not everybody wants to participate in the study. So those of you that can help us when we actually do get around to doing our recruitment effort, we'll show our timeline at the end of this. It's, to be able to get that 1,000 adults and 300 children sounds easier than it really is. So the next slide, please. So I just want to review our eligibility criteria at the high level. So it's adults 18 years and older and children who are aged 44 to 17 at the time we actually enrolled them. And these will be adults and children who lived in the study area, which now is going to be a much larger area, anytime during 2005 to 2017. So this means someone could have lived there before this time. Someone could be living there now, but you had to be there at some time during that window of 2005 to 2017. If you moved out and went to Florida and you know somebody who and they used to live here, they're still eligible to be in the study. The only people who are not eligible would be somebody who was exposed to PFAS through their work. So this would include, somebody who was a firefighter and was exposed to firefighting foam that had PFAS. There are some factories that use PFAS. If you're in a Teflon making factory and you work there, I don't think there's too many in our area that actually do PFAS, make PFAS, but that people who work directly in a PFAS industry would also be excluded. And if, anybody who is currently in prison or under house arrest would not be able to participate in our study. So can I have the next slide, please? So this slide represents the locations of the private, residential, and municipal drinking water supply wells where we currently have measurements of PFOA and PFOS, which together have been recorded at or above the red symbols, the 70 parts per trillion, or below that are the yellow ones. So the private wells, which are the circles, were sampled by DOD contractors. And the municipal wells, the crosses, they're the larger ones, and they were taken offline as a result of PFAS testing. And some of those we were told have been put back on service because they've been treated. So this is sort of our starting point. We started with the green with Warrington, Warminster, and Horsham, and the wells that we knew about. And then you can see this blue outline, which we'll talk about later. But since we are expanding also, and right now we're sort of dependent on the information that we've gotten from DOD, if any of you or any of your friends, people have independent values measurements that you got on your private wells, we'd be very happy to have you contact us and supply that information, because that'll just the more information we can have on private wells, the better. That would help us. And you can contact us by email or by our toll-free number. And those are going to be at the end of the slide deck. And that will be available also on our website. Can I have the next slide, please? So as previously mentioned, the group 1 participants are going to include people who participated in the peat biomonitoring group, and it's also include residents whose private wells were equal to or exceeded 70 parts per trillion of PFAS. So the red circles now again show where the locations of those private residential wells were that had high levels of PFAS. So we're kind of calling them our sort of hot wells, right? And most of these, as we said before, are around the bases. And also you can see that there are some ones that are outside the boundary of Warminster, and we are also going to include those wells. So anybody, if someone's still living, those are the ones we'll target. You will send, letters or postcards or some way to outreach to people who actually have these wells to participate in our study. And right now we do not have the peat participants included on this map, but we'll be putting down there were originally 235 of those, and we'll be putting their residences on our map that we'll show you at the next meeting. But most of those are also around the bases. All right, can I have the next slide, please? So the other bigger group of targeted participants are going to be those that we're going to get from, that are going to be in these census blocks. And that's the brown area. And you can see that these are all in the 3 townships that we originally had targeted. And we got these areas by picking areas that were close to the municipal water wells, which are those red crosses. And then we were able to do, so, let's see, where were we here? Some engineering type of, we don't have the actual water reconstruction done yet. So we did some engineering types of looks to be able to forecast where we thought the highest levels would be. And that's what we have in the purple. So we've estimated affected high levels of municipal water supply. And then around that, we built the census blocks that covered that area. So what we would do when we actually target these people is we'd be able to get actual addresses and link them to their locations in the census blocks. We haven't decided yet how we're actually, so we said before that we actually had 12,000 households that are in these census blocks. So our plan probably is not going to send letters to all 12,000, but we haven't decided our sampling strategy yet. So hopefully we'll have that for you for our next meeting. Okay, and you can ask me questions about that after. I know it's a little complicated, and we actually have our water specialists and our sampling specialists that also can answer if you want some detailed questions about how they did this. Okay, the next slide. Oops, that one. Okay, so this one shows the original 3 townships that we had, Warrington, Warminster, and Horsham. And then we have the additional ones that we're hoping that we can also include, the brown ones. And these are all townships that we think that we can reasonably attribute their PFAS exposure to releases from the military bases. And so, as I said before, what we'll do with these will be people that can volunteer. If you live in one of these areas, when we, you know, this looks like what we'll be able to have, we'll have it narrowed down for sure before we start our social media, but we will have a social media campaign. We'll have outreach at town hall meetings, and that's where we'll try to get all of you to be able to, if you're interested, volunteer for the study and give you more information. All right, so for the next slide, this is just a review of our schedule. And we've been doing our project startup and preparation since the fall of 2019. We are looking now, we're beginning to do a site office establishment. It's going to be in the Green County, the Green Townships, because centered closer probably to where the bases were. And we've just begun the process of trying to explore real estate in the area, but the idea is to establish our site office in the spring. And then we'd have data collection and recruitment beginning in the summer of 2021 through the winter of 2021. So about 6 months of actual steady office visits. So hopefully we will be able to have a, you know, this summer will be a good time to be able to actually open our office and have people come, and you know, we definitely look forward to people participating. And I think that's my last slide. Is there questions? Yes. Next slide.
Great. Thanks, Linda. I think the next slide is our Q&A session now. So I'm migrating back over to the Q&A feature, and we'll be going through some questions for you, Linda. First one, there seem to be many studies regarding the water contamination of PFAS. So we have evidence there is PFAS in our water at some point. I'd like to know when there will be research showing how we can remedy those of us that have PFAS in our blood work, or is there already a protocol for that? We have the blood work and we all have it in our lab work.
Oh, you mean, is there a way? I don't believe that there is a way, once you have PFAS in your blood, to get it out. It's not like lead where they think they have chelation to take lead out of blood. So there's a half-life to PFAS, and it happens to be pretty long. I think it's something like 6 or 7, 8 years. But so I don't know of any way to get it out of your blood, unfortunately. I don't know if anybody else on our panel does.
Yeah, there is no
you need to,
medically recommended way to remove PFAS. Linda's exactly right. What we recommend with clinicians and people who've had an exposure is to stop the exposure, you know, which is something that has, through the water treatment here and the water hookups for private well owners, that's already happened. But there is studies out there about how giving blood and breastfeeding and having children and certain cholesterol Medicaid, they have shown to sometimes reduce PFAS levels in people's blood, but that is not, those aren't things we recommend for anyone. There's no protocol to follow, unfortunately.
all right, next question, Linda. I live in Horsham, about 1.25 miles from the base. I've lived here going on 38 years. Before that, lived for 4 years in Warminster across from Johnsville base for 2 of those years. I had Warminster municipal water supply. 1983 to 1996, I had Hatboro municipal water supply. In 1996, Aqua purchased Hatboro water. There are over 100 of Horsham residents that have Aqua water. I don't have a well or municipal water, but I had and raised my children on water polluted with PFAS. Please tell me why we are not included in your studies.
No, you are. So that whole other, the big one with the census blocks, I assume you, from where you said you lived. So actually we're including 260,000 people in our study. So if you live near these bases, I mean, the townships, do you want to flip back up 2 slides? Can you go backwards? Yeah, that one. Okay, anybody who lives in the green area or the brown area at the moment, we plan to be eligible for this study. It could possibly change a little bit, but we don't think so. Our best guess right now is that anybody that is in the green or the brown area could volunteer to be in the study. Our targeted sample is the area that we showed before that's closer to the bases. And that's just people that we're going to reach out to a sample of those, probably through postcards or something like that, because we want to try to get people who we think have the highest exposures. But even if we didn't, even if we sent, you know, if you got a postcard and your neighbor next door didn't, they could still volunteer. So we really want, it's very open. So if you want to ask more refinement, you could, but I think we've really enlarged the area. You know, 250,000 people are eligible now, except, well, close to it. You know, you have to be at least 4 years old.
And how will you be finding the additional water sampling sites? Will you request volunteers among the citizens? I live in Buckingham with a private well, which you are welcome to sample.
Oh, and it looks like Buckingham is not in our area at the moment. Or was that a question that was directed at RISA maybe? I don't know. So if Buckingham is that township that's outside of Warwick, they're not in our area at the moment. So we wouldn't, I don't know, Ted, do you want to comment if we got well water from up there? Any area that's not in our green or our brown?
Hi, can you hear me?
Yes.
Okay. We are looking for, as Linda mentioned earlier on the slides, private well data that we have in hand, well, sort of have in hand at this point in time, is only been collected by contractors on behalf of the bases. We are very interested in collecting information, documented lab analysis of wells, private drinking water wells that are not in that group. So if you have documented, lab analyses of your well water with PFOA, PFAS, PFSHX, any other PFAS, we would welcome the donation of that information. A well in Buckingham at this point, based on investigations to date, and again, this is subject to not knowing exactly what goes on underground everywhere, are less likely to be caused from a release from either of the bases. I may be wrong, but the likelihood is pretty low. So if you're in one of the highlighted areas on the map currently, and the Department of Defense or a contractor representing them has not sampled your well water, but you have done it on your own and you have the documentation for that, we would love to have that information.
Thanks, Ted. This next question might be follow that response to Ted and Linda. Could you explain what water testing data you've been able to review from any water utilities in Bucks and Montgomery counties?
The water data that we have to date is what has been publicly made available. We do have information on the municipal water supply operation in the 3 central townships, but not beyond that point. So any of the measurements of PFAS in the municipal wells we're getting from public sources. The project, the funding for the project does not include sampling activities for going out and collecting additional water sampling data. So we're using publicly available information from the time PFAS was identified in the municipal wells, and for the most part, most of that information, as far as I know, is public.
Thank you, Ted. Next question. Let's see. My father worked at the base in Warminster and died from colon cancer in 1995. I've been diagnosed with ulcerative colitis and would like to know stats on these health issues as well. I know ulcerative colitis was in the original C8 study.
What's the question?
Are there stats on health issues that we might not be studying that potentially we could post, Linda? Ulcerative colitis. I don't know if any of our panelists have that.
Well, I mean, there's going to be a number of other health topics that are going to be sought in the questionnaires. Yeah, I don't know that that is excluded necessarily, but you know, it's a pretty broad type of questionnaire. I know and that's something would probably be easier to study than cancer, which has the longer lag period. But I think, as you know, not PFAS still, this whole study really is what we call a hypothesis generating study. We know some things that have been linked to PFAS, but the whole idea is to find other things that might be. So I think it's really open to getting information from anybody who participates in the study and linking so that's why we want to actually have people be able to link health outcomes and exposure to PFAS itself. I mean, there may be people with health outcomes that have very low levels. There may be people with high levels of no health problems, but we want to be able to take that all together and you know, generate some hypotheses that can be followed up and even more rigorous studies.
And also, ulcerative colitis is in the draft protocol. So I do think that's one of the health outcomes that we're very interested in learning about.
Yeah, and I was just going to interject that there is some evidence that PFOA is associated with ulcerative colitis.
Okay. Next question, how about cancer in children? This might be related to Risa's. We had to skip around a few of the questions.
Oh yeah, so neither, Risa's study is not directly looking at cancer in children because she's not getting that information from the cancer registries. There's different types of permissions that need to be given for that. And we're also not directly looking at cancer in the multi-site study, but I'm sure we can be collecting information, open-ended types of information. And, I think any health issue, I think we'd want to know about anyway. So I would want to be able to collect that information on child participants as well. We'll just have to see what kind of flexibility we have when we get the final questionnaires and protocols from ATSDR.
The next question is, what is presently being done to rid our drinking water of PFAS?
Is that a Laura question?
Sure, I can try. I mean, there's folks from the water authorities are on here, and I'm really glad that they're here. There's been a lot of significant work to put treatment, very effective treatment on the public drinking water supplies and to hook up private well owners to the public water supplies if they met certain thresholds in the vicinity around the base. That is a much smaller area than what you're seeing on the map there. You'd have to, I could share in the chat where you can see where the Navy and Air Guard have been doing that remediation work, but the affected public water supplies are definitely being treated now.
Thank you, Laura. How do you qualify for the testing group?
Is this for participation in the multi-site study, we think? So basically, at this, we went through the eligibility criteria, and basically at this point, if somebody lives in one of these areas that's green or brown on the map, is the right age. If you're an adult, if you're a child 4 to 17, and if you lived in one of these areas sometime during 2005 to 2017, and you did not have an occupational exposure to PFAS, because that's going to be a whole different type of, we're looking at the drinking water exposures from these bases. So we're not really looking, we don't want to contaminate that with looking at occupational exposures, but that occupational exposure would be really the only rule out, other than if you're in jail or something. So I think most people should be eligible to participate.
Next question is, I'm pleased that we in Bucksmont are finally taking next steps related to PFAS contamination consequences. Since other communities around the country have similar PFAS problems and have done similar studies, why can't we use their results?
Yeah, I think, so right now, our study's part of what's called the multi-site study, and so there's 7 sites that are using the same questionnaire, and then there's also the pilot site up in Peace, New Hampshire. So this is, I think, totally, we're enrolling something like 7,000 adults and 2,100 children. So it's pretty large overall, and the idea behind this one is across these different geographic areas is to get a wide range of different types of levels of PFAS exposures. And I think, so we had the C8 study, and so all these are some of them are different types of PFAS as well. So they may have different properties and different effects. And then there's newer PFAS that are coming on. So I think PFAS is not going to go away. it's going to be something that's going to be studied more. I think it's, you know, it'll be nice to get more funding to be able to do even higher quality studies. So like Reese is doing her spatial one using a case control study. So that's good if you're going to look at particular, if you already know what you want to look at. So she's targeting specific cancers and doing a case control study. We don't know exactly what diseases we want to look at in our community. So that's why we're doing this broader look at exposure and a whole bunch of different outcomes. And then hopefully later on, we'll get more money and your community will also be able to participate, and we can narrow down and do some more detailed types of studies of some of the diseases that are coming out of this, and hopefully even be able to plan a big cancer study. So I think, David, are you on? Do you want to give a more overarching comment about PFAS in different areas?
Yeah, again, yeah, I'll be happy to. I think, you know, one of the reasons, as Linda said, the advantage of a multi-site study, there's several advantages. One is, of course, bigger numbers than we could get from any one place. But also, again, as Linda mentioned, there are different configurations or mixes of forms of PFAS. And so to try to get a deeper understanding of how the different specific chemicals may relate to health outcomes, using these different sites is helpful. But also in epidemiologic studies, as we well know, it's hard to get the right answer. There's a lot of reasons that it's challenging to zero in precisely on whether there are adverse effects or what the patterns are. And by having these constellation of sites, you can see an overall picture that's more informative than any one site alone. So that as informative as the Pennsylvania site will be, and the Colorado site, and California, and so on, when you put that together, it really adds a lot of information value to beyond what any one site can do, no matter how well that site is managed.
Yeah, and I think the unique thing is that we're going to all use the same questionnaire. We're going to all have the same laboratory tests done on the serum and the urine and that type of stuff. So the idea is to be able to combine all these data together. The models that will look at the exposure reconstruction from the water and how it predicts exposures over time are all going to be the same. So I think this will, you know, I think this is where ATSDR and CDC have done a lot of planning to be able to put this together and get enough numbers. And, you know, all we need now is, you know, to be able to recruit, you know, enough people into the study at all these sites. So it'll be really informative.
Right. Will the study include diseases such as Graves' disease, a thyroid disease, in addition to cancers?
Yeah, I'm pretty sure thyroid disease is one of the topics that they're very interested in.
Yeah. Besides cancer, what are some other possible effects of PFAS exposure through water?
So David, do you have those at your fingertips?
I'll be happy to again say a few words, and you can add more if you want. I mean, there's an array of diseases that have been linked with varying degrees of certainty to PFAS exposure, including elevated cholesterol, the various thyroid diseases, as we've mentioned. Also, somebody mentioned ulcerative colitis, certain types of cancer, kidney cancer, and others. But I mean, I think it's worth emphasizing how incomplete our knowledge is. There may be little fragments of information or suggestions or possibilities for a number of other diseases that haven't either been proven out or disproven. And so there's a lot of, the menu is quite large. And as was mentioned, in the study, we will ask questions about a wide range of diseases. It doesn't mean we're going to be able to address each of them definitively, but we will at least collect some information about a wide range of diseases. And it may be worth mentioning as well, something that hasn't come up. in addition to the diseases themselves, we'll be looking at a number of biological markers that are related to the diseases. So, for example, ulcerative colitis, which is clearly of interest, we may not have that many cases because it's a relatively rare disease, but we'll be looking at immune markers in the blood that has relevance to these other conditions. Same thing with Graves' disease. Again, we may not have a number specifically of that, but we'll have information that would be relevant to those other conditions from some of the biological measurements. The clinical laboratory measurements will be helpful as well.
And then also for children, there's going to be neurocognitive testing. So that's a whole area, another interesting area that hasn't really been explored that much, that we'll be looking at in this study.
And in addition, thinking about children, there is evidence of a decreased vaccine immune response for children. And then also hypertension and preeclampsia. Pregnant women are at higher risk.
I mean, it may be worth mentioning as well, though, and I think this is certainly familiar to those of us who do research, just because something on the list doesn't mean it's an established concern. And in fact, the reason we do the research is to flesh that out. And I'm quite confident that we may find, in fact, some diseases where we do find associations. I'm also quite confident we'll find many where there's no evidence whatsoever of harm. And so just to sort of remember or acknowledge that just because we're speculating about something doesn't mean that there is a problem. It means it's a question, and some of those questions will get a negative answer, I'm sure. Some may get a positive answer, but that's what we'll find out over time.
Will you be assessing PFAS exposure as a whole or relate each PFAS substance individually? What about mixtures?
Okay, I know the idea is to collect information. I think ATSDR is interested in the 4 main ones, but I think they said they were probably going to be looking at maybe Lauren knows more too, maybe 14 different ones in the blood or something. And then I'm not sure, I think they will be doing like what they call a PK/PD type of model prediction. And I know a lot of the sites are interested in mixtures. And so I think some of that will be modeled. We haven't really worked out all those details yet. I don't know, Laura, do you have any other additional information on that?
I don't know the list of exact constituents that the blood testing is going to cover.
Yeah, so I mean, we're still working on those overarching protocols because, as we said, we want to do the same thing in the 7 multi-site ones and Peace, New Hampshire. So all 8 of these different geographic locations will be doing the same kind of tests and the same kind of models. And we still are waiting to get all the final lab procedures and everything from CDC.
So the spatial analyses, we will be, to the extent possible, modeling different chemical mixtures. The weighted quantile sums that I mentioned allows us to look at highly correlated data, like the different types of PFAS. So to the extent that the data are available, we'll be able to model that.
Yeah, so ours would be modeled from the projections from the blood that we're then feeding. The water information will go into that model to help be able to go back in time, to be able to predict what someone's exposure was, taking their current exposure and then using this reconstruction and the PK modeling to try to figure out what someone's exposure was over the longer period of time. So it is pretty complicated. I'm not, it's not really, I'm not a modeler that does this type of thing, but it won't just be from the water data. It'll actually be using the blood specimens, urine specimens. But the water is really important. And that's why originally we weren't sure we'd be able to expand the area because we weren't sure if we would have enough of the water data. Because without the water data, then we can't start the exposure, right? So we need to have some kind of water information to feed into our model that we then link with our blood and urine tests. So, but hopefully we'll be able to give you, real more detailed scientific protocol as we progress through this process.
I've been diagnosed with sessile serrated polyp syndrome. My doctor said it's hereditary and doesn't know why I have this high risk for colon cancer. What should I explain to him about the PFAS and how I can continue to monitor it in my blood work?
I was trying to put a little bit of that in the Q&A for others, that ATSDR does have a fair amount of resources about talking to your doctor about an exposure to PFAS. And, it's a complicated conversation. There aren't firm answers about what that level of PFAS in your blood might mean for health outcomes. In your case, with an illness like that, it'd be great to talk with you offline a little bit about, what you might continue to share with your doctor. So I think my contact information is in the chat. I'll put it again in there just in case if that would be helpful.
If
Thank
I
you, Laura.
thing for this particular question, if you already had your blood tested by us in 2018 and you have a number in terms of your PFAS levels, if you are able, well, we will reach out to you if you were previously tested. If you are able to get your blood tested this time around as well, you will have some knowledge then of how much it is diminishing or what the levels are currently. So that is one way of having some continuous testing as we get into the next year. Beyond that, though, I'm not sure, but that is one way if you were already in the study.
How do you volunteer for group 2?
So that's the volunteers. All right. So that is, so at this point, so this point, it's totally open. We haven't decided how we're going to recruit people, from group 2, but I think we're going to have a phone number, and people can call in and get screened. And, if you meet the screening criteria, then, we can set you up for a clinic visit and online. I think right now they're in Peace, New Hampshire, they're doing, trying to do telephone interviews because of COVID. I don't know whether we'll keep the telephone interviews or hopefully can do some in person more, but there definitely is a clinic visit. So, but right now Suzanne, when are we thinking of opening enrollment? Probably not till next May.
Right, May, June, depending on when we get all the systems in place. And then clinic visits would start in the summer.
But we will be publicizing. We'll have it on our website. We'll work with Bucksmont. We'll work with your representatives. And Susan's going to be describing the CAP. And there's representatives on the CAP. We're going to be recruiting people from the community for the CAP. We're going to have open CAP meetings. So there will be lots of, hopefully, time as we head into next spring to give you all more information. So, definitely but it'll be, a phone call. You will call us and volunteer, and we will screen you and see if you can be in the study. But if as we went through, if you're the right age and if you live in the areas that we said are open for participating and were there at the time 2005 to 2017, then it's likely that you would qualify. We're not excluding on any health conditions or anything.
The next one is just a comment, then I'll move on to the next question. I live in Springfield, but my water came from the North Hills well, so please include any place that was served by the wells that were contaminated before they were shut off. And then the next one is a question. You keep saying you hope to be able to include the additional areas included. What is the litmus test? What is the holdup to confirming that those areas will be included? I think those are the brown shaded areas.
So I'll punt that over to Ted, because I think as he'll tell you, we don't have all the water data we want yet. So this was sort of an engineering estimate of what we think we have. But Ted, do you want to give a little more detail without getting too technical?
Sure, I'll try. So the area, if we could move the slides back to, actually to the, what, I think 21 more or two more, please. Right there. So right now, this is the data set of exposures that we have. There are other wells that are not, other municipal wells that are not shown that have measured PFAS concentrations that are below 70 parts per trillion for PFOA and PFOS. And those will be included in later maps, but outside of the 3 townships of Warrington, Warminster, and Horsham, I was focused on identifying 3 wells that had the highest municipal wells that had the highest concentrations of PFAS measured in them. And you can see them in right on the boundary between Horsham and Upper Moreland, in Upper Dublin, and between Upper Dublin and Abington. The presence of any additional data that is has been collected from private wells outside of that collected by the contractors for the Department of Defense. If that information is available, please contact us and let us know that you have it. And if that happens to expand the area, and we think that it is one reasonably connected to a release from the base based on the groundwater modeling that has been done to date, and I'll caveat that in a moment, then that would have an impact on the stability of that blue outline that we're looking at now. One of the objectives, and one thing to keep in mind, one of the objectives of the study is to try and maximize the models. We've been talking about several different models. The model that is going to try and determine how PFAS has moved in the groundwater in this region, that model is not perfect, and we're trying to maximize volunteer and targeted human samples with predictions from the groundwater model. And and we already know that the groundwater model has shown that there are some areas where PFAS has been measured and likely caused by releases from one or the other bases, but the groundwater model did not predict contaminants flowing in that direction. So we know that there are shortcomings, because this is a very complex area to try and predict using a computer. So we're going to try and do the best we can to maximize that outcome of people and predictions. But we won't be able to match everybody who participates. That's a reality going in, but that doesn't impact the size of the region that we think are likely impacted either through measurements or through our understanding of the groundwater flow and the soil that it flows in or fractures it flows in, to do our best to estimate what we think that extent is. And so that is what has kind of guided us in terms of drawing that blue line or identifying those other townships around Warrington, Warminster, and Horsham. A long answer, I'm sorry, but it's a complicated problem, and we're doing our best to try and be as realistic as possible.
Yeah, we need to be able to estimate some type of PFAS exposure for everybody who's in the study, or else we can't generate the historical piece, so
right.
If we don't have a good exposure, it really doesn't help us to have an outcome, right? So you need the 2 pieces, the exposure and the outcome. So Ted's working very hard to be able to understand how PFAS has come from the base. And we're only looking at the water that PFAS that we think has gotten to the water from the firefighting foam from these bases. Now there may have been, I think there was some place that had a fire or someplace that was further away and got some PFAS exposure at one point in time, but that is not what we're looking at in this study. This study is really from the continued contamination from these bases.
Are the red crosses and circles current contamination or past contamination?
They are past contamination, but within 2014 to 2018, I think. We're looking for them. We were given the time frame that we're simulating up to, which is 2017. We'll be looking for data up through 2017 and a little bit beyond to help us improve the predictions of the model.
If a person lived in another state where there is known PFOA groundwater contamination and now lives in one of the areas where volunteers will be recruited for the study, are they eligible to participate in the study?
Suzanne, could I just interrupt on one thing for that prior thing?
Oh, of course.
I just want to reemphasize what I said earlier. Those, even though that's relatively recent data, those red private well markers, they are not representing people that are still drinking that water at that higher level. Those are folks that have been hooked up for the most part to the public drinking water supply.
Okay, so the other question is, right, if someone was exposed in an area outside our townships that we've drawn here.
But now lives in this township area.
And if you moved here, right, if you moved here after 2017, we would not include you in our study because you would not have been exposed to the water contaminated from these bases. But if you live like in New Jersey, they're doing a study there. So there could be other areas that are also, you know, doing some studies, but our criteria is you had to have lived in our study area at some point during 2008 to 2017. You could have lived, and you could have come from another area with, we also, yeah, I mean, you could be in New Jersey and contaminated and can't, been exposed to PFAS and then come to our area in 2015. And yes, you could be in the study. And, you know, our water reconstruction is not going to be perfect. And Ted, I don't know if we, so we will have people that would not have been in this area and we wouldn't have exposure information on them. Do you have a thought on that?
The model will be trying to predict what people would be drinking in this area from the time of releases when we think PFAS was being released from these bases up until 2017. So if you were present during that time and you also intersect with the time frame of the study for human participation, then the model would be able to address those exposures, or will attempt to address those exposures.
Yes, I mean, so it could happen you come to this area, let's say you do qualify for our study, but you lived in, like there's, you know, maybe you're in 2 studies. I don't know how that might even work, but there's other areas of the country, obviously, that have high levels of PFAS. So you could have exposure to PFAS that's going to show up in your blood that may be higher than we might have predicted based on where you live and your exposure in our area. I mean, this is not, this is a hypothesis generating study. Neither the exposure nor the outcomes are perfect here. This is sort of a first look study. And, you know, it's really the first type of broad-based look across all these communities. So it's not going to be a perfect linking between exposure and outcome, but I think it's a good start.
All right, and a lot of the remaining questions, I think we have time to answer. They're more location driven and several comments that I'll go through. Since we know there is PFAS contamination in Bucksmont, why can't the local municipalities use appropriate filters in their water sources? From your map, I see that Lower Moreland is excluded.
That's correct. From the information that we have at this point, we don't have data in Lower Moreland to show that PFAS has, from the bases, has reached that area. Again, we're working from sources provided by the municipal water supplies that they've put on their public websites, and from data that's published by the Department of Defense contractors, or by the Department of Defense collected by their contractors. There's a person
I'm
with their
pleased.
hand up.
Yeah, Suzanne, there are two people
Oh,
who
sorry.
had their hands raised for quite a while.
Okay, let's answer those questions. Cameron and Debbie, can you help give rights to those individuals?
They
Hello?
both have rights now. Yep. Hello, Joseph.
Okay.
Joe McGrath here. I was an employee from 1973 to 2007. As of the meeting last night, they're still getting readings up in the, I got 17,000, 55,000 for the different wells, intermediate wells, shallow wells, combined wells. And then when they discharge this, it comes out for the effluent, comes out to 70 parts per trillion. So all this business from the plume area, which is around building 680, is all being treated and down to 70 parts per trillion. But if you're looking for a population, you're saying, according to Ms. Brown, that based on employment, all those people that would be in those gray areas, whether it be Johnsville or Willow Grove, would be excluded from, I guess it's the testing that you would be doing. Those folks would have to be volunteering.
Well, wait, but what was your employment? What was your actual job?
I was a survival equipment technician.
So did you handle PFAS itself?
Not at all.
Right. So unless your job involved PFAS exposure to PFAS, then you're eligible to be in the study.
But I have to correct you on that, because if it's coming through the wells, it's coming through the water system. We're drinking the waters out of the water fountains, and we're having food prepared in the chow hall
Yeah,
that is using well water.
So yes, you had the exposure that we want to study. We are only excluding the folks that had an occupational exposure on top of that.
Right. If you were a firefighter, if that was your job and you were exposed to as a firefighter, then we couldn't include you. If you had some other job on the base that was not directly related to PFAS, you are eligible.
What's the reason for separating it?
Because that would be an occupational exposure that we couldn't separate out from the drinking. So it's just this. So, and also it has to do a little bit with, this study is being funded by, being run by ATSDR, and their mission really is more the environmental part, where there's another agency, NIOSH, who really does occupation. And I know they're thinking about a firefighter registry and that kind of thing. So it's a little bit semantics. You might say, why can't you include everybody? We didn't make these rules up. This was, the design that was the government's decision to exclude people who had the occupational exposure, so that we could separate it and then just look at people who had the environmental exposure separately.
Well, I'm not getting warm and fuzzy about talking about the government, because even with the RAB has nothing to do with past exposure. They seem to be worried about future water supply. And
Yeah,
it's like whatever they did in the past, we'll let somebody else handle it. It's no big deal. And it is a big deal, because the VA will not honor anything if I come into a center and I have a cancer situation. They will not honor any kind of a claim that I know of, because the Navy doesn't recognize the folks that have been there as a responsibility. So the VA, from what I hear, is turning people not down, but turning them away, because they're sitting on the fence as far as whether or not to accept these as viable claims.
Yeah, I mean, I'm sure this is not just an issue for, PFAS. I mean, issues with what DOD and VA accept as claims have been an issue for other types of diseases. And, even Agent Orange, I think, took 20 years or something before they
You're right.
accepted it.
We're
So,
not going to make it 20 years.
I feel your pain. It is really out of the scope of the study we're doing, but I definitely feel your pain.
Okay, well, I'm going to keep on with what my mission is.
Okay. But we hope you'll participate in this because you do. It sounds like, you would be eligible.
I'm already a volunteer for your CAP program.
Great. Thank you.
All right, and we had, I think Joseph has also been given rights to ask a question live.
Thank you. I'm
Parisi.
finished.
I didn't know if we had another community member who wanted to ask a question live from our panel who might be muted.
I thought it was Lisa Cianelli had a question, had her hand raised.
So Joseph Parisi is the person that looks like the hand is raised but is muted. So Cameron, if you could help Joseph Parisi.
I've asked him to unmute.
I know, do we have another individual that would like to ask a question live or has a hand raised?
If so, please raise your hand again. That's all we have at the moment, but there, I know it was
Okay.
two earlier.
All right. Well, certainly Joseph can interrupt me at any time when he unmutes. I'll move back to just the open 9 remaining questions opened. I'm pleased to see Abingdon and Upper Dublin included in the potential expansion area. As I and others have been asking, how can we help ensure that happens?
Well, I think, this goes back to what Ted has been talking about. And as long as we can get the right kind of water data, I mean, you can help if you have any information on any other types of water sources. That would also be helpful for us.
I would mention that for the areas that are currently shown in green, Warrington, Warminster, and Horsham, we do have detailed, the municipal utilities there have been very helpful and have supplied us with the technical information regarding how water is distributed in those townships. In the neighboring townships, so far we have been trying to get that information, and so far it is not forthcoming. So the nature of the predictions in those areas will be not as realistic. So if there is, the more information we get, the more participation we get from the municipal water supplies or private water suppliers, will improve the quality of the work that we do. But without the information, I can't make predictions without information.
Why is Lower Gwynedd not included?
I think the same answer regarding Lower Moreland. We don't have at this point. I'm not aware of any private or municipal well data in that area. If there is, please bring it to our attention.
And how will this study differ from the one my family and I participated in recently?
So I can answer this one if you're talking about the studies that Pennsylvania Department of Health did earlier in 2018 and 2019. So those studies were essentially to determine whether PFAS was in the community members' bodies. And of course, we found that it was in those 235 participants. In 2019, we also came back in that summer and we determined whether PFAS was in various sources in your household, like the tap water, in your household dust, And in urine, we also measured that. So what is different in this particular study? This is the first time that we're able to try and assess or make connections between how PFAS exposure and your levels may affect your health. So this one is specifically for health, whereas the other previous studies, if you remember, we were not able to address really health and the connections. So that's what this one is for. So hopefully that answers your question.
Thanks, Susan. When and where will the offices to volunteer open?
You can ask that one, answer that one yourself, but.
That's fine. I will, Linda. I was waiting for you to give that back to me. When is in the summertime we will have this opened? We're looking at starting clinic visits July 1. Where is still to be determined. We have a report portfolio that we'll be going over with the CAP soon of potential locations for the site office. And we'll publicize that and make that available. Let's see, I live in Upper Dublin, right across the Horsham town line. Thank you for including our community. Will there be a toolkit of study information to share? Would like to offer to host a small group session with neighbors or smaller community groups ahead of the recruitment period starting if possible. Thank you. Yes, we will have information to share, and we will be publicizing recruitment information in advance of those clinic visits. So I haven't thought of it as a study toolkit, but we do that on other studies, and certainly we'll take that recommendation back, and take a look at our current materials to see if we have something for those small community meetings that you'd like to host on your own.
Right, and we have representatives from all the, well, we should from most of these areas on the CAP, and too, so they could be reaching out to.
And they'll be disseminating the information as well. Yes, yes. Let's see, as I've understood from previous meetings on PFAS in our area, one of the key pieces of information that is needed is how many parts per million or parts per trillion of PFAS are acceptable in our water supply. As I've understood it, the US EPA has not set the acceptable lower limit for PFAS. Who is addressing this question?
If you want, I'll try to at least tell you what I can about it. I mean, it's been, sort of until recently considered 70 parts per trillion, usually for some combination of two particular chemicals, PFOA and PFOS. Many states now have lowered that rather significantly, but it's there, as was noted, there's not a national policy, so that each state is coming to its own sorts of judgments, which is probably not an ideal situation. But there's, I think over time, there's a tendency to lower the levels of what is considered acceptable. It varies, and it varies by the particular form of PFAS, but it's, in the range now in many cases of 10 parts per trillion for specific chemicals. It's variable though across the different locations. I don't know what it is in Pennsylvania right now, but others may be able to speak to that.
Yeah, there's no regulatory value for PFAS in Pennsylvania. So the EPA lifetime health advisory of 70 part per trillion is still, it's used to.
All right. So, yes, Dan, do you want to move this? And
we will. We'll answer the remaining questions, any that come in later.
There was one final hand raised if you wanted to cover that question. I'm sorry.
Okay.
Stephanie, did you have a question?
Oh, sorry. My type function wasn't working for some reason. I was wondering if folks with other first languages, and if there'll be like any translation help or something for people who want to participate in the study. I can think of some folks in the immigrant communities around there who I know are concerned and but don't find all this information super accessible. So wondering if there's like any Spanish language participation possible.
All right, so is it Spanish? I think ATSDR is actually going to be translating the tools into Spanish, so we could have access to that. I don't think we have the capabilities for other languages, but I think we should be able to do Spanish.
That's so great. Thank you.
All right, Debbie, I think moving back to our presentation, then we'd like to give Susan a couple minutes to give us a CAP update. Susan, I'll turn that over to you, and then we'll have our video presentation from Bucksmont Coalition.
Okay, thank you. I know we're running a little short on time, and I know we would absolutely want to get to that video, so I will go through this fairly quickly. So next slide, please. Next slide. Okay, so yes, I am Susan Schrackwood. I work in the Environmental Health Division of the Pennsylvania Department of Health. So essentially, we've been working on forming what is known as a community assistance panel. And this is essentially your voice. It's the voice of the community to us. And so the purposes of this is for information exchange about not only the study, but about PFAS in general. So we are calling it the Bucks and Montgomery Counties Community Assistance Panel, or the BMC CAP. And as I said, the purposes for our information exchange, we're really looking for how to best represent the interests of the community. So the CAP assists us, the study people, with recruitment for the study. So how do we generate that community excitement that we need in order to get participants and people that are willing to participate? And how do we reach as many different members of the community as possible? That's really what we're looking for when we talk about the CAP as a group. Next slide. So this is a quick look at the organization that we have so far in terms of the CAP. Bill Walker of Horsham Township is our CAP chairperson. The municipalities that we have thus far, that needs to be updated because we're continuing to try and expand the municipalities. For veterans, we have Joe McGrath on there. We have the Bucksmont Coalition for Safer Water, the county health departments, so that would be Bucks and Montgomery counties. The legislators, we have both US and state legislators on here, and we have people from the water companies, from the Navy, hopefully, and from the Air National Guard. So these are our officials, so to speak. Next slide. What we really want to add are community representatives. So as I said before, we're trying to get as much representation as we possibly can on this CAP. So we've been also looking for other representatives. We've hosted several organizational meetings so far. We took a meeting, a webinar meeting in August and one just last month in November. We're planning for the first official meeting to happen in January. It's a working session. It's certainly open to the public, so you're welcome to, you're invited to join that virtual meeting as well. And in terms of recruiting the members, if we can go to the next slide, we're still looking for people that represent parents, the minority communities, the business owners, houses of worship, so religious leaders, probably daycares, maybe schools, maybe retirement communities. So, and we're open to suggestions. So if you can think of other groups or other areas of the community that need representation that should be on our CAP, definitely let me know. So we're still trying to form this to be a true community group. We're looking to meet about 4 times a year. Maybe more as the study progresses. It's really what we feel we need at the time. And again, those meetings are open to the public. So I don't know if you have questions about that. I know we need to get to our community video testimonial, but again, that's a quick run through in terms of what's happening with the CAP.
Thanks, Susan. And we'll share contact information at the end of the video presentation so you can get in touch with us if you don't have email and website information. All right, next slide then. I think we'll turn this over to Hope and Joanne from Bucksmont Coalition for Safer Water.
Hi, I'm Hope, and Joanne and I are super excited about this upcoming community health study. As you all probably know, we've been working behind the scenes, Joanne and I, for over 5 years advocating to get some health studies for our community. So needless to say, we're thrilled that it's finally getting underway. And we really hope that the community can embrace this PA study team that we have here, and that we can all work together to reach our recruitment goals. So thank you for attending tonight. And our emails are going to be on the last slide. So if you have any questions about anything, Joanne and I are both happy to answer them.
Yeah, sure. Hi, I'm Joanne. At each of these community meetings, Hope and I wanted to highlight a different community member who expressed interest in participating in the study through a short video. So with each interview, we hope to share a different perspective, personal experience, and motivating factor for a community member's study participation. So before we play the slide, before we play the video, if you can go to the next slide, if you or someone you know would like to share their personal story to be highlighted in a future video, please email us at the addresses on the screen. Okay, Cameron, thank you. Can we start the video?
Hi, my name is Renee Fergoli, and I grew up less than a mile away from the Warminster Naval Air Base. I grew up drinking water from a private well. Me and my husband are now living in this area, raising our 3 children in the Centennial School District. I'm proud to be a member of this community. This has been my home my entire life. I would like to share with you my story of why I'm so passionate, and I think that this health study is very important to my family and to this entire community. Our lives came to a crashing halt when we found out that my little 3-year-old daughter had stage 5 kidney cancer. At her time of her diagnosis, they found tumors, not just on 1 kidney, but on 2, not just on both kidneys, but on her lungs and liver too. It had metastasized. This changed my life forever. For me as a mom, I was wondering, and I needed answers. How could this happen to my innocent little 3-year-old baby? Barely able to walk and talk and take care of herself, is now full with tumors and needs poisonous drugs to make it go away. In 2014, I was devastated when I found out our water was contaminated with PFAS, and that was connected to kidney cancer. I was devastated to think that I, as Felicia's mother, who's supposed to be protecting her, had caused her this cancer as I was pregnant, or as I was serving her her formula mixed with the tap drinking water. As a mom, this guilt is so overwhelming. This health study for me is now a way to empower myself and help me and my family to get some answers. This is an opportunity for us to help the scientists find the answers about PFAS, and it can't be done without the community. I want my family's information included in the study so we can learn from our mistakes and prevent it from happening to another community. I don't want another mom to find out that their child has a cancer that could have been prevented. Like many of you, we've been full with anger. I'm tired of being angry about the situation. This study is a perfect opportunity for us to become proactive and do something positive. I plan on registering my family for this important community study and contributing to the scientific data on PFAS. Please join us in making a difference.
Thank you so much, Hope and Joanne, and for creating that video. Did you want to say anything in closing before?
Thank you all for joining. Again, email us for any information for Reese's study that she talked about earlier that we're looking for people. in the beginning of next year. And for any questions about the health study, both of us are willing to contact you or connect with you at some point. Thanks.
Yeah, and Linda and I had talked about having a separate section of our website for these videos as well. So we will be making that update and sharing with the community. All right. Thank you again. Next slide. And next slide. I'll switch to Q&A in a minute. So I just wanted the community to see for more information, a link to our website. A lot of you have already visited that. Many of you are on our distribution list. For general study information, our contact is presented there. Any questions related to the CAP, Susan's email is listed on this slide and on our website as well. And I think we have just a few more minutes, so we could probably switch back over to the Q&A session just to see if there are any final open questions that we haven't answered yet. What labs are used to test the samples, Linda?
Oh, where they're testing them, and we do not have that information yet from CDC. So
there's a CDC labs, but we'll be receiving more information on the procedures for that as we prep for the site office opening. And I'd like to participate. Oh, sorry, Linda.
Yeah, I mean, so they are going to be doing the testing in their labs. But so they're done across all the sites the same way, but we don't know where they are yet. They haven't given us that information, but that'll be available at some point.
I would like to participate in the study, but I moved recently. How will I be able to get information about being part of the study? Will something be emailed out? Yes, a lot of emails, a lot of social media, other media channels we'll be tapping into when we're prepared to start the studies. So again, that'll be coming in the late spring, and in the summer we'll begin enrollment. We hope to begin enrollment.
But also we have something on our website where you can sign up for information, right?
Mm-hmm. Yes, updates, email updates.
Right, so someone, you know, if you've moved and want to be in the study, if you sign up for study updates, then we'll keep you informed. And if you couldn't come to the area to come to our clinic, you know, then and you meet other eligibility requirements, then you could still be in the study as well. We can't come to you if you move to Florida, but you could come to us.
And then a couple of final questions. Are today's presentations included on the website right now? Not right now, but they will be by early next week at the latest. And could I get your website or social media information? I think if you go back to the prior page, our website is up there. Our social media will be launched in the next several months. And everyone who registered for this presentation, we now have you on our list as well. And so when we send out updates, you'll be receiving those from our study email address.
Right, and so when Ted asked for information about the wells, the phone number on there, 1-866-354-1076, and the website, PFAS Health at rti.org are both two places where you could send that information.
And again, if you are already a part of our previous studies with Pennsylvania Department of Health, we will be contacting you because you're automatically a part of this study if you're willing to be a part of it. So so long as my information for you is up to date, you'll definitely be getting correspondence from us.
All right. Well, I'd like to thank everyone again. Linda, did you want to mention a few closing remarks? We're at the almost at 9 o'clock.
Yeah, I really want to thank everybody for attending tonight. I mean, your questions were very thoughtful, and you know, we'll take that to heart. I think we did get through all the Q&A, but you know, if there are other questions you'd like us to address, feel free to, you know, call or use the website, and we will continually update the Q&A that we have on the website for other types of questions. And we, you know, look forward to everybody's continued interest, and we we will be giving more information at our January CAP meeting and probably, you know, a February or March community meeting.
Great. Thanks all. We'll go ahead and adjourn then. Have a good evening, everyone. Take care.